Good afternoon, everyone. Welcome to GRIPS Forum. My name is Michiko Eisuke, professor at National Graduate Institute for Policy Studies. I specialize in science, technology, and innovation policy, focusing on developing countries, and will be serving as a moderator today. The GRIPS Forum aims to inform policy debates by inviting leaders from various fields. It is a public event that also provides our students with the opportunity to participate and benefit from the lectures and discussions. Global health has become one of the most pressing issues of our time and is likely placed at the heart of Sustainable Development Goals, especially goal number 3, which emphasizes ensuring healthy lives and promoting well-being for all at all ages. Within this broad and vital agenda, two key priorities have emerged: universal health care coverage and the transformative role of digital health and artificial intelligence. Universal health coverage means that everyone, everywhere, should be able to access health services they need, when and where they need them, without suffering financial hardship. And Japan has long stood as a strong advocate for universal health coverage at the international level. Parallel to this, we are witnessing a digital revolution in healthcare. Digital health technologies and AI are reshaping how we deliver service, make diagnosis, and reach patients, especially in remote and underserved areas. With smartphones now in hands of billions across the world, the potential for digital service to bridge healthcare gap is greater than ever. Yet, global statistics remain sobering. According to the World Health Organization and World Bank, as of 2021, over 4.5 billion people lacked full coverage for essential health services, and in 2019, around 2 billion people faced financial hardship due to out-of-pocket health expenditure. The challenge goes beyond the financial barriers. The WHO has projected a global shortfall of 10 million healthcare workers by 2030, particularly affecting low-income countries. Clearly, the world needs innovative, scalable solutions. That brings us to today's seminar on the challenge to conquer blindness in the world using smartphone attachment medical devices by Dr. Eisuke Shimizu, CEO and founder of OUI Inc. The topic we are exploring, using smartphone attachment medical device to fight blindness worldwide, sit at the crossroad of universal health care coverage and digital health. It addresses not only the need for accessible and affordable care, but also leverage on the power of everyday technology to reach those who have been historically left behind. Today, we will learn more about how smart innovation can make a world of difference, especially for conditions like preventable blindness that, with a timely intervention, can effectively be managed or even eliminated. Now, before giving a floor to today's speaker, Dr. Shimizu, I would like to introduce Dr. Shimizu. Dr. Shimizu graduated from Keio University School of Medicine in 2013. He founded OUI Inc. in 2016, where he developed AI-based ophthalmic diagnostic system that won numerous global awards worldwide. Currently, he's working on the development of medical technology as a president of Keigankai Medical Corporation and a specially appointed lecturer at Keio University. He will be presenting for about 45 minutes. This will be followed by two panelists, and then later on, we will open the floor for Q&A session. So be ready with your questions. So now, ladies and gentlemen, please welcome Dr. Eisuke Shimizu.
Hello, everyone. My name is Dr. Shimizu from OUI Inc. and the Keio University School of Medicine. I'd like to thank you so much for a great introduction, and very happy to talk to in here. So I will I have 45 minutes for my presentation, so maybe I would like to talk about what we do. Who I am at the first point. So I'm gonna do my brief introduction myself, and what we do and why we trying to do this. Now, I don't think the audience is not super familiar with what is the situation and the background of our company. So we provide one short YouTube video, which what is our goal. So please watch.
There is no eye clinic. Even there is no single ophthalmologist and optometrist for 300,000 people. So that's why we can find many patients in the rural areas.
People need to travel 2 hours, 3 hours for hospital, so they feel very difficulties.
我々が着目したのは患者様のそばにいる医師たちでした。もし彼らが眼科医のようにそばにいる患者様の診察ができたら、たくさんの人を救えるに違いない、そう思いました。
The Smart Eye Camera is an attachment that enables eye exams using only a smartphone. It converts LED light into diagnostic light. This enables in-depth exams, including testing and early detection of cataracts. Unlike similar products that did not gain popularity in the past, the Smart Eye Camera is a simple design that can be made with a 3D printer, with a price that is 1/30th of the original. The interface is highly intuitive, and the tutorial movies no longer require training sessions. This means that even doctors who aren't ophthalmologists can use the device. As a result, the Smart Eye Camera has been introduced in over 60 countries, enabling more than 100,000 eye tests so far. The Smart Eye Camera is a breakthrough in price, ease of use, and access.
Smart Eye Camera solve that problem and make doctors, optometrists work very easier.
Okay, so this is Smart Eye Camera. The Smart Eye Camera is a smartphone attachment which enables the eye diagnosis, like the conventional, we call this microscopes, fundus cameras, or any etc. It enables the function, it uses the function of the smartphone's light source and the camera function, which makes the light which the ophthalmologist use. And because this is a smartphone attachment, we have an app to do the telemedicine between the countries where, of course, the internet is. And we are creating AI, developing AI to do the diagnosis. So that's all the platform we make, which I will introduce you today. So before I just gonna start, I'm just going to show you the function of the Smart Eye Camera. So you just open the application like this, and you record a patient's eye like this. It is super simple, pretty easy to use, user-friendly. Anyone can use it. And again, this is a smartphone attachment so that you can record the patient's eye, see it retrospectively, and we doing telemedicine with using of this system. Okay, let's go back to my talk, okay? So I'm just gonna do the self-introduction first. Like, who is this? So my name is Eisuke Shimizu, Dr. Eisuke Shimizu. I am the CEO of the company called OUI Inc., which is our startup. Plus, I'm the ophthalmologist. So my specialty is dry eye disease. As an ophthalmologist, I'm doing the refractive surgery such as LASIK, BTKs and stuff. And right now, we are building up the telemedicine system and creating artificial intelligence for the auto-diagnosis. So that's going to be my pretty much as my specialty for now. Now, we're going to talk about the OUI Inc. first. And the mission of the OUI Inc. is to reduce global blindness by 50%. And the vision is to save the people's life through their eyes. So reducing the blindness by 50%, as in this talk that there is a over 440 million people in the blindness people in the global, and more than 50% of those patients are blinded by the disease called cataract. I think most of the audience is familiar with the name of the cataract because the cataract is one of the aging disease, which I will get a future cataract. Everyone gets a cataract. And the character of the cataract is pretty simple. So the people's eye function like a camera. So we have a lens, we have the film, and in the human tissue, lens is called a crystalline lens, and the film is called the retina. Cataract is aging disease of the crystalline lens itself, so that people's lens getting worse by the UV exposure, by the air stresses, and develops cataract. Most of the patients over 50s start getting the cataract. So in the study in Japan, over 50% population starting cataract in the age of 50s, over 70% 60s, 90% 70s, 100% in 80s. It is curable disease because most of the patients in Japan or other like US, Europe, many patients are having a repairment of the lens, such as a cataract surgery to replace their lens to the artificial lens. When their vision is disturbed by the cataract, let's say their vision is down to 0.1, which is 20 to 200. But most of the cases, they will recover their vision into 2020, 1.0 after cataract surgery. So they can be back to their normal life. Your grandma, 85 years old, who cannot walk, who's just kind of hardly to walk and go to, the caregivers should take care of her because she's getting old. When those patients get the cataract surgery, they can walk by themselves. They can go to, convenience store. They can go to the supermarket to get their food. So that is the miracle of the ophthalmology, especially like the Japanese, especially like Japan, developed countries. We know that cataract is curable. However, in the undeveloped countries, no one knows that their eye will be recovered. So that's why we started doing this. So this is too small letters. I don't want to read it, but we found this unmet medical needs in the rural part of Vietnam in 2017, where I went to the free cataract surgery in the rural place of Vietnam. There was a program combined with the local NPOs and NGOs to help all the people in the rural part of Vietnam to do the free cataract surgery. When we went there, we gathered all the tools donated by the pharmaceutical company, medical device company, bringing inside all to the van, driving from Hanoi, I will say 4 or 5 hours, to just going around the near place of the China. And there is one single hospital there, but there's no ophthalmology, there's no eye doctor, there's no optical shop, there's nothing about the eyes there. So we bring all the tools, including surgical tools, intraocular lens, such as the artificial lens implanting to their patients. And we don't have any tools to make a diagnosis because we just rent one small van with full pack of nurses and ophthalmologists. There's no space for that. So we brought the pen light to expose the light to the patient's eye. Conventional method for the diagnosis of in the ophthalmology is that we expose certain kinds of light to the patient's eye. But pen light, with the battery from Vietnam, when I use that for an hour, maybe 2, all the batteries are gone. In that moment, every single participant, they start using their smartphone. They are using the smartphone's light source to exposing these light to patient's eye, trying to make a diagnosis. However, of course, these light source of the smartphone is not designed to diagnose the eye. So at that moment, if we can make some kind of the light source from this smartphone to make a diagnosis of the eye, we thought that we can help these people. We can help rural areas because all the residents are having their smartphones. So after going back to Japan, we spent about a year and a half, maybe 2, to make a first art model, called the smart eye camera. You just have to cover it and expose thin street light like this. And this is the magic of the light, because basic ophthalmology, we use this kind of thin street light. It's about 0.1 to 0.3 millimeter. And we succeed to create the light source from the smartphone and register this device as a medical device in Japan in 2019. And that's where we start our journey. So I will share you about the value of our company, our spirit to you. And this is our take-home message today. So number 1 is grit. Number 2 is evidence first. And number 3 is be cosmopolitan and be innovative. I will, share it to you later, okay? So, again, I will introduce about the smart eye camera. So, we started this project from 2019, starting with the street lamp model, which is a tool to diagnose cataract, dry eye, allergies. We call this the disease in the anterior segment of the eye. So front half of the eye. However, if you are living in developed countries, most of the patients are getting blind by the back part of the eye, the retinal disease. I believe all you remember about the eyes are the function as a camera, and they have a lens and they have a film. So the back part of the eye is the film part of the eye, the film. So as we talk with the many external collaborators, they all say that if we have a slit lamp, we want to have some kind of a tool to examine the posterior part of the eye. So we created the ophthalmoscope, we created the fundoscope model. As you can see, we use same smartphone with a different gadget. And all of these gadgets are built up by 3D printer, which are not containing any batteries, just a plastic of this itself, plus certain kinds of lens. Of course, if you go to the eye clinic, they have a bulky tool, huge tool, pretty accurate tool, but it's bulky, unmovable, and it's cost pretty high amount. All these tools, we sell it, I'll say, about 10 times or maybe 20 times less cost. I will introduce you a different one. So the slit lamp is the first model which we made, starting from Vietnam. This is the most essential diagnostic tool to diagnose the anterior segment of the eye, starting with the cataract, dry eye disease, and corneal opacity, allergens, and stuff. As you can see on this part, you can see this, I'll say, black, brown part. This is a tissue of the lens. When you were being, I'll say, 80s, 90s, you cannot see anything because of this. So the purpose of the surgery to replace this tissue into the artificial lens, and then you can recover your vision. Now, this is what's called the ophthalmoscope model, which is one of the tool to screen the back part of the eye, inside the eye. So this is we call the optic disc, and this tool is specially designed for the disease called the glaucoma. Now, glaucoma is one of the, I'll say this is the aging disease as well, but over 5% of mortality over 40s have glaucoma. And the film part, the retina, is not treatable, not like cataract. Because the retina is a nerve tissue, and at this moment, we cannot fix the nerve. And glaucoma will cause the visual field defect. So you could not see the vision wide with the glaucoma. And again, you could not recover the glaucoma, so that we have to find glaucoma as early as possible. And only one treatment is reduce the intraocular pressure using a certain kind of eye drops, lasers, or surgery to keep that severity of the visual field defect. So this tool is pretty good design in the glaucoma screening. Now, the glaucoma is not just only disease, but we have the huge needs gaining of the screening of the diabetic retinopathy. I think all the audiences know that what is diabetes is. It's pretty common diseases, and it's pretty severe diseases. Now, the diabetes is the disease to affect to the vessels. This is our fundus photo. And as you can see in the inner part of the eye, retina, we all have the vessels. So if you have a diabetes, you can be risk which these vessels get damaged. Easy to get hemorrhages, easy to get your retina to get damaged. And because of that, we have to treat the diabetes. And if you got the diabetic retinopathy, the treatment should be the laser to burn the retina, the bad part of the retina, or just injecting the some kind of the medicine to the retina, eyeball itself. So it is pretty invasive treatment, but we have to monitor this diabetic retinopathy, especially in the part of the development countries. However, if you see in the Southeast Asia, the numbers of the diabetes are increasing these days. So there will be the huge needs, especially in the Southeast Asia, for the diabetic retinopathy soon. Now, I did introduce about the several types of the our smartphone technology, but the key point is that we use the same smartphone with a different gadget. You don't have to purchase two phones, only one phone with the same application. And then you can do the screening of the front part of the eye to the back part of the eye. And doing with the telemedicine, you can consult to the specialist. And right now, and these devices are already registered as a medical device in 7 places, including Japan, Europe, Vietnam, Indonesia, Cambodia, and Southeast Asia, Kenya in Africa, and Brazil for Latin America. The reason why we choose these places is that, well, number one, we have a great partner out there, but number two, there is a huge need in those places. Now, I want to show you about the telemedicine, example of the telemedicine. This is one of our partner in Cambodia called the Angkor Hospital for Children. And this is Dr. Farah, only the pediatric ophthalmologist in Cambodia. Whereas his nurse, he's sending the nurse to the school for the screening. So he's doing the screening for the strabismus screening. And strabismus is one disease, and I will say that 1/4 of the population has, minor to severe strabismus, but sometimes they're gonna affect to their vision. So they have to do the treatment such as the surgery or using the spectacles, the glasses to do. Now, before installing this device, this Dr. Fala, he have to go to every school to do the screening of the children. And when he is doing the screening, he could not do the treatment, such as operations, seeing the patient in his hospital, because he's going to the outreach. But after installing this tool, he only have to send a nurse. He only have to send a nurse to the rural places, schools to do the screening, and he's just gonna monitor in the system all the children retrospectively, and make the diagnosis for the patient to just come to the clinic to do the treatment. There is a similar project, similar system is going on in different places, such as Kenya and the other Asian countries as well. Now, I'm sorry, I don't know why these are in English, but so we are creating the AI. Now, starting from the cataract, of course, because we have to, this is the number one disease that we want to treat, such as same as the, we call this anterior chamber depth and angle. These are the one parameter for the glaucoma screening, but there is two types of glaucoma. One is the glaucoma, which is developing slowly, such as chronic glaucoma, and the glaucoma, which will be going to be severely faster. So we say that acute glaucoma attack. And if that happens, patients could lose their vision in a day. So screening of the glaucoma attack, we use these value of anterior chamber depth, which is a length of here, length of this part. Or we use the angle of here, this part. And as you can see, AI is observing where we want to see, and we are developing a pretty good model. Besides that, we are making the AI for dry eye disease, corneal opacity, and conjunctival injection and stuff. Now, I want to just talk about why we are doing this, why we trying to reduce the word blindness 50%. It's that the spirit of the OUI Inc, the grit. As I talked to you before, we started this project. We find all of these medical needs in the rural part of Vietnam in 2017, where there was nothing for diagnostic tool. And at that moment, frankly speaking, I realized we can do this all through, screening with the phone itself, through the telemedicine and auto-diagnosing system. I have no idea about AI at that point, but I think that at that moment, I can make some kind of software for the auto-diagnosing system. So now what we do is we develop our hardware by ourselves. We have an engineer in our company, not just hardware, but the software to take the images, collecting the images, and then we develop the AI internally by ourselves. Not just that, we don't sell our product. As long as I'll say it later, but we make the evidences. So we make the presentation in scientific conferences. We publish as many papers as possible, and doing the demonstrations worldwide, and doing the medical device certification and registration by ourselves. So this system that we can do in our hand, and that's what we want to do. Because if we export some of these, either of these in the different company, they will do what they want to do. They don't help the people. They don't help the people in the rural areas. So we think that we have to do all these by ourselves, and this is the most easy way for us to achieve our goal. So that's what I mean about the grit. So I will share the sample video again, which we use our tools in the rural part of Vietnam last year. So in 2017, we had the medical needs there. Of course, during the COVID-19, we could not go there. But luckily, all of our time of the COVID is done, so we can gladly go to Vietnam now. So we bring all the tools, bring it back to the Vietnam for the screening.
老後の一人暮らしに不安はありませんか?
Okay, so I'm sorry about advertisements, so I'm just gonna talk. So we are partnering up with the local NPOs, NGOs, not just Vietnam, but all the part of Southeast Asia, which are doing the screening or the cataract camps. And as you can see on this video, these are the places of the cataract camp where there's no ophthalmology. So we bring all the kit there, all the microscope, all the tools there, just renting the the operation software. These medications are donated by Japan to dilate their pupils, and we do the screening there with a small eye camera. So this is 2024, which we brought the devices, but in 2017 we do not have anything. So we are gladly, bring back all the, our technology together in the places. And now, not just about the diagnostic tool, we are trying to increase the quality of these system. So we brought the optometrist to do the screening of the eyes as well. All about, bringing back our idea into the, to the ground zero, which we found. Okay, so we all, okay, so I'm just going to go back to our talk. So, yeah, I really like to see the smile of the patient at the post-surgery. Okay, so now, let's go back to my talk now, okay? Okay, so from now on, I'm just going to share about the traction. I think you already mentioned enough about the value of the device itself. So from now on, I'm going to talk about the, how we collaborate with the partners. So this device is, of course, already sold in Japan, of course, but our main target is global, so that we are trying to expand the device globally. So if you think about like a normal medical med device companies, if you have a product, you find the distributors exporting a device, just selling it. We don't do that at the first point because we want to make an evidence first. So the evidence is that we published a scientific paper by ourselves with a collaboration with our many international partners. We start doing that starting from 2022, and right now we have over 60 MOUs, with the collaboration researches together. Now, and right now we have 26 scientific papers already published with using this device. And as you can see on this slide, we already have a partner in worldwide, especially in the rural part of these countries. And as you can see, we install all these devices in these countries. Now, we do the direct, researches, direct, collaboration with the local hospitals, of course, but we use the part of the grant as well, starting from the grant from the IFC. This is the before Corona, and some, developing banks and joint projects with ADB. We are installing this device in every elementary school in Bhutan to do the screening. So these public procedures will be one more value of our project. And again, I would really like to hear about all the great users' voice of our collaborators, and same as in the doctors in Vietnam. So this is one good thing about the device. which when we make these kind of tools, and when we talk to the doctors, especially in the overseas, they will care about the evidences. Of course, I'm the one of the part of the academic parties, but one of our target is making the evidence. So as you can see that there is only 26 articles that are published, and that's what we start using this for the sales as well. If we can do some kind of the collaboration for the evidences, that would be great. And if your countries are not written in these places, I think you could be the number one to publish it. Okay, so maybe it's going to be about 10 minutes from my to last of my talk, so I'm just going to finish it with this, what we're going to aim in the future. Now, we have the device itself. We have a telemedicine system. We are developing AI. But this tool is only the purpose for the diagnosis. So this is not a complete solution. What is complete solution? Is the ophthalmologist, the eye doctors. They have to prescribe, for example, if there's any infection to the eye, the local ophthalmologist, they're going to prescribe the antibiotics, eye drops, or maybe oral medications to the patients. If the patients have a cataract on the other hand, the surgeons, the ophthalmologist is going to do the surgery to the patient. So we have to tag up with local hospitals, local or maybe NGOs, which have the active ophthalmologist, not the consultant, but just actually working there. So that's why the second reason we want to collaborate with all the doctors pushing the evidences. Because for those doctors, they are super, super busy all day. As you can see on that Cambodian doctor, he has to do the screening of the patient, treatment of the patient, aftercare of the patient by all their selves. So he is working, 24 hours, 365 days per year. But if we can install this device to those countries, those places, at least they can do the screening. Maybe they can do the aftercares, so that the ophthalmologist, they can focus onto their main values, such as treatment in terms of surgery or giving the medication. So that's what we want to do, to delivering diagnosis to all the areas which have not been making a diagnosis. And this is pretty interesting personally. There was a same needs in Japan. In Japan, we have over 400 isolated islands, which is resident by the more than one person. And most of the islands, I will say over 100 residents have one single doctor, but that one doctor is not the ophthalmologist, of course. We have 330,000 doctors, medical doctors in Japan, but the numbers of ophthalmologists is only 12,000. So I'll say about 2 to 5% of the medical doctors is ophthalmologist. So in those rural places, they don't have any specialists. So we are targeting. We didn't know the needs when we started this product. We only thought the needs is only in rural part of the countries, but undeveloped countries. But that was a surprise for me that there will be needs in Japan as well. But for example, in Tokyo, we have 11 islands. 2 is super isolated, about 1,000 kilometers from Tokyo, south from Tokyo. And they only have, 3 doctors there with no ophthalmologist. But interestingly, they are connecting to the internet so that we already installed these devices in those islands and doing the remote diagnosis from the mainland in Tokyo to the remote island. So doing these our project, we of course aiming to target. We of course targeting to the global, again, which is delivering the diagnosis to reduce the blindness. But in where we live in Japan, we have a needs. So we can keep digging the needs as long as possible, as deep as possible, even if you're a startup. Doesn't matter if you're a startup or not, because the solution is same. We can provide the diagnosis from the smartphone itself, telemedicine, AI, and collaborating the local doctors or local ophthalmologists, we can give them the actual solution, which is a treatment. So our mission again is to reduce the global blindness by 50% using this device, bringing the diagnosis to the society. Now this is our last value. Because we have an innovative team, our core member is less than 5, but this is pretty interesting team. We have the Indian medical doctors in for the medical side. We have a half Ukrainian, half Russian girl. Well, she already graduated, so she's not intern anymore, but she speaks like 5 languages for the business side. We have software engineers, hardware engineers, AI engineers to build up our device. So, collaborating with the team from the medical side, engineering side, business side, we're trying to reduce the world blindness by 50% with the spirit of these 3. Grit, we can do it anything. There's no limit. We're building our device ourselves, creating the application, creating AI, making scientific evidences, and doing the medical device registration and selling to the customers. We do not outsource anything because we are the one who knows how to achieve our goal. Evidence first, because this device, we are the company by the medical doctors. We use the evidences to expand this device worldwide using data marketing, and the team should be more innovative as possible. So the OUI Inc., we only have about 20 members. So I don't know if it's appropriate, but we are, we are very open to our job every time. So if someone is curious about, collaborating with us, we are really open for it. Okay, so that's gonna be it for my presentation. Thank you for listening.